Good evening, friends. And today we are back with our next episode of Baro Buddies. And today we've taken a special topic to discuss. And this is essentially because now winters are setting in. And sometimes when you talk of obesity, it is the seasonal change which is very important. So today's topic for our discussion is going to be Baro Winters, talking about winter food, winter health, and how winters can affect obesity. And I think we have a very special guest today. We have with us Dr. Richa Jaiswal. So, warm welcome to you, Dr. Richa Jaiswal. So,
Thank you
Madam
so much.
is a senior dietitian from the most premier institute of our country, All India Institute of Medical Sciences. She is a registered dietitian, essentially in surgical disciplines. I had the privilege of meeting Madam a couple of months ago while working on a paper together. And thereafter, I thought it would be very appropriate to have her on our show and talk about how winters can affect obesity. Especially, Madam is placed in Delhi, and in Delhi, definitely the winters are quite fierce. It's not as much as J&K, but definitely much more than North. So I thought in Delhi we should have Dr. Richa there. So thank you so much, Madam, for taking out time and joining us today.
Thank you so much, Dr. Nitin, and the entire organizing team. I am really honored to be here, and it is our practice that we feel like contributing to the community. And I am open to the discussion, questions from people, and I would try to answer as much as I can.
Right. So there's a very good evening coming to you from Mrs. Swapna Jain, who's one of our regular listeners, and
Okay.
she's greeting you and a warm welcome. So I think without wasting much time, we just got 30 minutes of precious time with Dr. Richa. So let us start immediately the questions that we think are important and just trying to understand the issue about obesity in winters. So Dr. Richa, as an overall, as a nutritionist in your clinical practice or as a nutritionist, what would you say are the unique challenges that somebody would face in winter while managing obesity in the Indian population?
So, Dr. Nitin, as we know that to control weight and to manage the weight, it is important to follow a certain pattern, especially related to the eating habits, behavioral, and the second thing is the physical activity. So, the first thing which I struggle a lot with patients, so to whom we advise to follow a physical activity for a certain duration and in their daytime on a regular basis. So we experience a lot of hurdles over there. Then you, as you mentioned, that Dilli ki sardi, so it is not similar as it used to be 20 years back. And nowadays, the moment we transit from summer to a winter phase, the AQI in Delhi is very difficult. So advising anybody to go out is difficult is one thing for the physical activity. The second thing which we feel a major challenge is in change in weather brings a lot of health issues, especially in a vulnerable sections, like elderly or any pediatric population, or maybe the person who have already lungs ailment or something. So if somebody is sick and somebody is not able to breathe appropriately at this that point of time, you are more focused to a certain line of treatment line rather than advising them just focus on a weight loss or anything. And as a doctor, you know that the moment somebody has a cold, cough, or certain things, they have a liking for a particular food items, maybe particular taste, maybe particular temperature. So it becomes very difficult to encourage them to have more of a raw food items or salads which are fiber rich, and advise them appropriate diet. So that is one challenge. The third most challenge which we face during the winter, because the people connection with the sunlight or duration reduces, so that also reduces the melanin production, and that also impact the mood, and the that impact the choice of food, desire of a choice of food. So that turns more towards the high calorie options. So these are the
A lot of
challenges which
points.
we face. Yeah.
Right. Thank you so much. I think there are a lot of learning points that we are getting from Dr. Richa. I think, but a special focus and a mention that I'd like to highlight is in the vulnerable population. I think in winter, sometimes we are just focused on our routine way, the way we handle. But I think when we are handling people who are very old or children, I think we need to focus on them as well. And definitely physical activity and the dietary changes that changes during winter. It's a challenge for everybody, including for us as healthcare professionals. So definitely all the points are very well taken. Maybe moving on, and especially talking of North India, where the regional dietary pattern during winter, सर्दी के कुछ ऐसी
Yeah.
सब्जियां या ऐसा कुछ खाने को होता है जिससे वजन बढ़ता है. What are those foods that you feel are obesogenic during winter? Regional patterns in general.
So, see, moderation is a key. So, like in winter, generally people don't follow the moderation pattern. There are certain food items which comes only in the winter, and people think, कि, okay, अभी खा लेते हैं, फिर बाद में देखेंगे, something like that. So, the most important, if the moment you think about the north side winter, the first thing come to your mind is like gajar ka halwa, and people have I mean, I do not know how southern side people uh, think about the gajar ka halwa, but it is very very popular. The winter means gajar ka halwa, that is mandatory thing and that everybody eats. The second thing which is very popular in the northern region, especially certain section like Punjab, if you go to Punjab or towards in Delhi, that culture travel to Delhi as well. So यहाँ पे like मक्के की रोटी, सरसों का साग and a lot of butter. If you come to cities like Delhi and the fast-paced cities where butter consumption increases in the winter season more, people find it easier to digest in the winter season of fatty food items, especially the butter, ghee, and all. And those consumptions also increases. And if you go towards the northeast side or northern side of our country towards the eastern side, so they have a preparations which is more from the good. So jaggery is the main component and they use a lot of nuts, seeds with that. So nut seeds goes down, which is a nutrient dense stuff. The major taste comes from the jaggery. So jaggery consumption also increases on day to day basis. So 3 months approximate, entire 3 months or entire 4 months, depending on the temperature, they consume a lot. Consuming is not a bad thing, like in which phase, which age you are consuming, but the burning, like calorie burning and the physical activity is minimal in comparison to the calorie intake. So that is a bigger challenge which we face in the northern regions. And I think jaggery is very popular in entire India. So if you preparation may vary, but then again they use a lot during the winter season. Then in certain part of our country, ganne ka juice is very popular, and they drink a lot during this phase, especially between 2 to 4 p.m. And these all things means I am not against any particular food item, but then again these all things contribute a lot to a high rich calorie rich diet.
Completely agree. And jaggery, as you
I
mentioned,
forgot,
not
I
only the
just forgot the
quantity.
laddus.
Right.
Yeah.
Laddus, I would say, is probably perennial, but maybe a little more in winter, with
Yeah,
or maybe during the spring season, during Ganesh Chaturthi and
especially the
other
gond ka
festivals.
laddu, and that is very rich actually. Yeah.
Right, right. But yeah, I think jaggery ka, the other point I'd like to really highlight is there's also a false belief that it is safe and it does not
Yeah.
increase glucose, as compared to sugar, but not realizing that the caloric value, the glycemic index, and the
True.
impact on glucose is quite a lot, and it's not absolutely safe to have that. But nevertheless, I would say gajar ka halwa is not only famous in the north. I was in Mumbai a couple of days ago, and there also it was selling, and South India has it.
Okay.
I think the only difference, I would say, having stayed in North and South for quite some time, I would say the color of the carrots is very different from North and
Oh,
South, and it's a different color, gajar ka halwa, but the calorie and the sweet part is just the same. So
yeah. Okay.
similar health risks. But thank you for that answer. With this, moving on, I think again, being in India, we have a lot of festivals, lot of customs that we follow. Our culture is very rich, and like you said, it's not bad to follow anything. It's not bad to eat anything. Moderation being the key, but there are certain festivals and the foods that are associated with festivals. December time we do have very good, Christmas, New Year. In South we have Pongal, Sankranti, and a lot of festivals that really come in. So, what would be your comment on winter foods and festivals per se?
So, Dr. Nitin, very good question. And if I have to answer, I would say that nowadays in India, our traditional food has been replaced by packaged food items and more of a sugary things. So, if you see the festival celebration pattern, you hardly see the traditional food stuff in the tray on a regular basis. The most of the things would be a purchased one, packaged one, and every get together or celebration festival means like meeting the people, celebrating togetherness and celebrating meals with them. So generally our festivals are celebrated in on that pattern. So the entire visits and meeting, if you calculate, the most of the time it is going to be cookies, chocolate, cake, pastries, colas, burger, pizza. So these all things have been taken the major section. The traditional festival food items are generally defined to a particular day. Preparation pattern is defined to a particular day. For an example, if I take a Diwali celebration, so definitely everywhere Diwali celebration, there would be something with oil, something should maybe fried, maybe one sweet in the meal. But that is not for the entire day. That is for a meal for a particular day, and then it's over. But whatever the things you have purchased from outside and which is high in calorie, which you received as a gift, you are going to eat on a daily basis, no? So these all things, the festival preparation, traditional preparation per se may not make bigger changes in the person's calorie intake, but the purchase, the high calorie, high sugar rich things, high salt rich things may impact our health in a bad way.
Absolutely. And there's a point coming from our audience. Swapna Jain, madam, is saying that winter also brings a little more weddings, and with
Yeah.
weddings come irresistible foods, and making overeating and obesity more common. The wedding feast, especially in North India, it runs for over a few days. It's not like 1 day and 2 days, but sometimes 4 or 5 days, different functions every day. Just food is the focus, and
Yes.
that is also possibly an added factor.
Yeah, very, very true. Very well got a point. And that these all things generally we don't count. But meetings, most of the meetings, most of the marriages are happening more in the winter season. So definitely the adding on calories are more common in this season.
Another question that is coming up from our audience is about sleep patterns in winter. We also were thinking about this. How would that influence obesity, and what would be your comment on the importance of sleep when you counsel patients for obesity?
So sleep pattern, matlab everybody would have a different way of sleeping pattern in the winter. So winter per se, how much it impact the sleep pattern is, it is too um, uh, vague to say that winter per se affect the sleeping pattern. But in winter, generally people sit on bed most of the time, and once you are confined to a particular place where you are getting sleep or you are not getting sleep, if you are sleeping you may not eat, but if you are confined to bed and you are not doing any activities or going out much, then definitely you are tend to eat little more food stuffs during the like sitting period or non-active period. And in winter, generally the nuts and the peanuts and the other laddus and these things are already prepared and kept at home as a reservoir. and everybody like tend to eat these things because these are not freshly prepared food items. These things are prepared in bulk. So if you are confined to home and not doing much activities, and definitely you are tend to eat little more. That is very common thing. It's not related to winter or summer, but it is more is like where you are spending most of the time in a day.
Absolutely. So I
You want
think
to add?
yes. Yeah, no, confinement is definitely there, as you rightly mentioned. I think from earlier times, the habit has been, to keep more food at home during the winter so that you don't have to go again and
Yeah.
again. Physical activity is limited, but that access to food itself becomes a bit obesogenic. But
Yeah.
then, when you're talking of physical activity, you mentioned about air pollution problem, especially in Delhi and other northern cities. And the days are much shorter in winter. There's already so much work to do, and then on top of that, the days are short. And then the first thing to cut out in the day is the exercise because morning is too cold. At times, we would
Yes.
actually, as healthcare professionals, tell our patients not to go very early morning in the cold. But then,
Yeah.
what would be your tips to a patient? In busy urban Indian cities, how do they maintain their physical activity in the winter despite all these adversities of pollution, shorter days, etc.?
Yeah, so Dr. Nathan, very, very valid question actually. As you mentioned, as a medical professional, we ourselves say no, advise our patients not to go too early in the morning or maybe very late in the evening, especially if they have certain ailment associated in addition to the obesity. So and they do not have time in the day to walk or work. So and we all advocate and we all practice that after every hours, like 6 minutes, six. So six time in a day, 6 minutes walk, and every six hourly, every 4 hourly, if they can manage, that would be great. And for professionals, generally, I say I try to practice myself also. Okay, like every professional have approximate 30 minutes in a daytime for a lunch break. Minimum of 30 minutes has given in every workplace. 30 minutes has been assigned and given to them. So we need to prioritize. Like these periods may go after 2 months, 3 months. So the extreme weather will definitely go after 2 to 3 months. So these 2 3 months we need to do a little more effort for our own health, and that period can be divided into 15 15. So 15 minutes can be utilized for the physical activity, whatever level physical activity a person can do in their work premises. Maybe a calf raise, maybe a hand raise if difficult to move out from the cubicle. And people like me who are, or you, who are like more blessed to take a round around the premises. So we can do that, and maybe sitting on a chair, some level of activity can be done even at night, in the morning. Now the myth has gone completely, where people think that only the morning hour work activity can help them to maintain weight or can boost their energy level, something like that. So whenever, wherever you get time, some degree of or some sort of exercise need to be done. If you can manage to keep a stationary like equipments at home, resistance band at home, it can be done easily. Exercise, there are multiple exercise pattern easily available on YouTube that can be used to practice at home.
Very, very important point. I think you've really broken a very important myth, and all our listeners will benefit from this point. I think there are two things you've clearly mentioned, that it's not only morning walk that is important, but I think another very important point that you've really brought out is that you can break your exercise time. You don't have to be fixed कि आज आधा घंटा नहीं मिला तो नहीं करेंगे. So
Yeah.
as you said, small breaks. It doesn't matter whether you do it together or you break it, but it's the duration in total that matters. So you can break your exercise, especially in patients with diabetes. After food, you can walk after the meal, and that will help your postprandial glycemic control also. But a very important message: it's not only morning walk, anytime walk. It's not only one time walk, but it can be small bouts of multiple sessions that you can do, and it's a cumulative time, which is very important. Thank you, Dr. Richa, for that very, very important message that you are leaving us with. I think we've talked about food, and हमने बोला कि गाजर हलवा कम खाना है, मक्की की रोटी है, मक्खन कम खाना है, लड्डू कम खाने हैं, but क्या खा सकते हैं? I think many times with patients we want to tell positively. So what would you say are the top three snacks which are healthy in the winter?
Okay, so see, at one end, if we are getting only carbohydrates, at the other end, we get a lot of green leafy vegetables in the winter, a lot of vegetables, variety of vegetables in the winter, a lot of low calorie fruits like low glycemic index, so these are many things. So for snacking, relying on vegetables and relying on fruits in a limited quantity. Vegetables though can be eaten a little more, but fruit should be in a limitation. Although it is a good thing, but should not be eaten in a excess. And these two stuff should be included in the. If I consider in a day 2 or 3 snacking, so one is snacks or vegetables. Second snacking should be seeds and some amount of nuts to it, and the third can go to any warm drink like maybe a cup of milk, so something like that. So I divide in a three different segments rather than relying on a biscuit, cake, pastries, namkeen, samosas, or any other food stuff.
So again,
And
very, very
homemade
important.
preparations also.
Right. I think
So
that's an
homemade
important.
preparations also, like they are some people yeah.
Yeah,
Yes,
please go
so
on.
homemade preparation like pilas and homemade dhokla. I ask them not to eat outside dhokla because those things are like with sugar syrup. So I ask them to, if you wish to eat at home. Then there are some South Indian, any fermented steamed food stuff and sprouts could be a very good choice. And combo of things like some people don't like sprouts, so like adding some amount of nuts on top of that to add some crunchy taste, or maybe little more vegetables with some salad dressing. So I think some concoction are really good things. So to simplify that, as I mentioned, one fruits and vegetable, one seeds, and one hot warm low calorie drinks.
Absolutely. Excellent options given there. And I think a lot of our listeners will benefit with their advice, and completely agree. I think the variety of vegetables that we get during winter is much more than summer. Summer is tinda,
Yes.
tori, loki, and that's about it. But here, there's so many good green leafy vegetables and different types of vegetables. So I think very well said, Dr. Richa. I am conscious of time. We have 5 more minutes, and there are questions which are coming up. So let me just quickly ask you one important burning question, which is about children and adolescents in winters. They are sometimes at higher risk, again, not going out to play. So what advice would you give to your patients as parents when they have to manage children with or adolescents with obesity in winters?
Okay, so two things I want, because winter has a variety. So and the pediatric population, they are actually picky eaters, and they have certain specific choices. So saying no to them to because of the calorie and all wouldn't be a very good idea, because they are not going to listen you in that way. So it's important for the parents to use those healthy stuffs and make that stuff according to their wish. So including, like, if even if for an example, even if they want to eat burger, so burger base can be healthy. The good amount of vegetable options adding in that could be a healthy choice. Then putting like, instead of putting so much of calorie dense spreads, like a spread can be prepared at home from the hung curds and all. those things can be added. This is just one example. The second is like the pediatric population, adolescent, they don't feel like eating green leafy vegetables, which are nutrient dense and less in calorie. So those stuff can be topped up in dough, in dal, in different vegetables or different preparations, rather than just asking them to eat in a raw form, as adult people generally prefer to eat as a salad. So these kind of variation is very important. Then second thing is like, if you don't do, your your child will not do. So if you require to be there, not only role model but be with them, and because role model could be any, but if you are there with them, if you are doing something, they are tend to do follow the same pattern. Physical activity is very important because we are very protective for our kids, and we in winter or any other things, we don't allow them to go out. In Delhi generally, even as a medical professional, we don't ask people to go out more frequently in this season because of the AQI. But then, as I mentioned, like there are many things, like we can play with kids at home, or we can do some resistance training, which is very interesting. And since it is not taking too much of your energy in doing that physical activity, it would be easier for children also to follow the pattern. And if you have plays, then playing with kids would be a very good idea.
Lot of brilliant suggestions, Dr. Richa. I think a very important point, setting an example yourself, not telling no to children. I think very, very important points that you've really told from, these are practice pearls, I must say, that are very, very important for all of us to follow. And definitely playing is a good way. And especially, playing games which are not just sitting board games, but do involve some physical activity. But great points, and I think maybe we can take one point from the audience as the last point that is coming up, and that is in winter about low water intake. That's another area that is very important because people hesitate. They're already passing urine very frequently. There's less sweat and water loss, which is less through the skin. So people, do they mistake it for hunger? And low water intake itself would sometimes lead to overeating and increased snacking. So, as a dietitian, what is your advice to people about water intake during winter, and does that help in weight loss?
So, Dr. Nitin, what less water intake is a part of any obese people like pattern, the life pattern. It's not related to winter or summer. So, it is important to advise them to drink good amount of liquid. Liquid doesn't mean water. Liquid means like it could be a soup, it could be a lemon water, it could be a coconut water along. And if you are drinking milk, could also be considered some section of that in the liquid or milk preparation. Then we eat dal, vegetables, so those section also be. So 500, if you minus, at least 1.5 liter minimum of 1.5 liter of liquid should be taken in an entire day, including some water and the other liquids if they are taking on a regular basis. To have that much of, I ask them to divide it into three different segments of the day. And in the morning, I ask them to have little more, morning till evening, and evening till night, because in a winter they don't feel like getting up and going to washroom. So I ask them, if you have reservation, or if you don't want to have more of a liquids in the evening hours, then try to finish off at least a liter or maybe 1200 in the morning hours, and remaining in the evening till night, and keep sipping it. So that is one thing which I say. And uh, and ask them to monitor their urine output, color, and if that is darker, then it means the hydration is poor. And how dehydration can impact their health, that I also tell them, that if you are dehydrated, then definitely you will not get enough energy to work, or your mental function will also impact. So this way I try to encourage them to have a sufficient amount of liquid, at least in a minimum amount, if they are not having in a like in our day to day practice, many patients they have only 500 ml of water in an entire day. So we require to encourage them to have minimum of 1.5 and increase it slowly.
Absolutely. So yes, water intake is important, and keeping track of how much you're drinking. Looking at urine color itself gives you a very good indication, as Dr. Richa said. And then definitely you have to make sure that your fluid intake is about 1.5 liter at least, uh, even during the winter. So I think the half an hour has just passed in a flash of a second. Thank you so much, Dr. Richa, for giving your pearls of wisdom of your years of experience. I think our audience is just enjoying it. There's a lot of greetings and thank you coming to you from everyone who's logged in. But I think we would love to have you back on the show sometime again in the next couple of months, maybe talking about your own specialty, after bariatric surgery, what nutrition advice do you give? And you have so much experience on that. I think we will definitely have you back on the show sometime when time permits in your calendar. But it was really great having you. Thank you so much for taking our time. I think our people who've joined in really, really benefited. And I think we should have a certificate for you. So, Team IGCP, do we have a certificate for Dr. Richa? Yes, and there
Thank
it
you.
is. And thank you so much for joining. And we look forward to have you again. There are greetings also coming from Dr. Ramji Agarwal, who's greeting you and thanking you for
Thank,
joining in today. Thank you. Thank you so
thank
much.